My name is Mwebantu. I am the head of department here at Munali Girls Secondary School, special unit. My role here is basically to coordinate the teaching and learning for our learners with special education needs. So in a nutshell, this is who I am and what I do. The dynamic of special needs at Munali are as follows. We have learners that are hearing impaired, as well as learners that are visually impaired. Basically, these are the two groups of learners that we have at Munali. These learners have varied degrees of impairment. We have those that are mild, those that are moderate, as well as those that are, severe. But at the same time, we also have those that have multiple disabilities, whereby maybe they may be hearing impaired, but at the same time also they may have some intellectual disabilities. So in a nutshell, those are the two main special needs that we are catering and providing for at Munali Girls. As you are aware, COVID has been with us for close to 2 years now, and from the time COVID started, we have been sensitizing these learners, and because of that, they have become aware of all those code and rules that are required for them to keep safe from COVID-19. So I think from my point of view, I would say that our learners are very much aware of COVID-19 guidelines.
I'm a visually impaired teacher, short-sighted. I offer civic education and RE. On top of that, I also do Braille. I handle both able-bodied children and also visually impaired children at the unit. COVID has brought a lot of challenges for both us teachers and also learners. There are a number of topics which we need to cover, which we have not covered because of the COVID. So as a teacher, I can say we are so much behind in terms of covering these topics. Equally with pupils themselves, they are also behind. Imagine some of the pupils, they are in the examination classes. So it has been a big challenge for us in terms of teaching, and also for learners in terms of receiving this knowledge from us. And then also another challenge is that, as I alluded earlier on, I handle pupils with visual impairments. So it has been a big challenge for these children to know most of the guidelines. Remember, these children, they depend on hearing. They can't see anything. So most of the activities concerning COVID-19, they are advertised on the TV, and the children cannot see them. And then also, this child is always with the guide. So we are seeing some challenges. This child is able to touch at any place, because for her or for him to move to allocate where the class is, he or she is supposed to touch here and there. But we are saying touching here and there is something which is bad for to get this COVID. So for these children who are not able to see, them they don't care. That is actually part and parcel for themselves to allocate wherever they are going. So they need to they need to touch anywhere here and there.
The pupils that I teach specifically are those that are hearing impaired, but we've got other impairments here, like the visually impaired. They could also have some other physical impairments, but they are not so much pronounced. The ones that are so much pronounced are hearing impairment and visual impairment. We have had quite a number of challenges when it comes to the classroom section. To begin with, the classes are very, very small. And then the number of pupils are quite many. So keeping social distance has been a challenge. You find that where pupils are supposed to sit one on each desk, you find that there are two, and the desks are not big enough. So social distance is quite impossible to be observed. And then when it comes to wearing masks, they do wear as long as the teacher is there, but the minute you leave, they remove them. And then we've also had challenges trying to remind them each time. You find that instead of wearing their mask the way they're supposed to be worn, you find them just covering the mouth and leaving the nose. Yeah, I think the problem is that they are in class for quite a long time, so they tend to suffocate. So they want to take moments of breathing fresh air. But the challenge is that when somebody wants to breathe, they cannot keep on going out because lessons continue. So they tend to miss out if they do that.
Basically, our learners, those that are deaf, they depend on sign language for us to interface and communicate with them. And sign language, unlike spoken language, it's a visual language. And one of the guidelines to prevent COVID-19 is the wearing of masks. And as you sign, you're supposed to talk at the same time. But when you're wearing the masks, you are preventing the learners from, reading the speech. They can't read the movement of the lips. So we find that some of our learners, especially those that are able to do a bit of lip reading, they are lagging behind. They can't really understand what you are trying to teach. It is very difficult in terms of communication, because it's like these masks, as much as they are, useful and they are able to prevent, the spread of COVID, but at the same time, for our deaf learners, they serve as a barrier. My appeal would be that maybe our learners and the teachers who are handling these particular learners, if they can be prioritized in terms of vaccinations, so that maybe eventually we'll do away with this need of, masking, and then we get back to life as normal. I would love the powers that be to consider our school, to consider our teachers, to consider our learners. Also, even the issue of, the PPEs, we need a lot of them. These learners, they keep on, losing some they misplace, others they get damaged. So it is not just a one-off, thing to say if you receive a donation, then that's it. It should be an ongoing process. So definitely, I'd love to meet and speak and appeal to those people that are in policy-making, positions, so that we can hear us out.
These children are able to do a lot. It's just that sometimes we have got a negative view. And to tell you, I'll give you maybe a testimony. I think there are two pupils that we have taught here at Mnali. The other one is a teacher. I'm not sure if he's not a teacher or is a lecturer in USA now, as we talk. The other one is also graduated from University of Toronto. So you see, what is important is let's help them. Whatever we have, it's important to help them. Even as these two people have talked about, we were helping them. And for sure, they are doing something great.